Good afternoon and welcome to the Senior Navigator podcast. We are here today with three gentlemen, Shane Bray, Dr. DeMorais, and Dr. Ferris. Thank you all three for joining me today.
And the lovely Mary Cordova.
Thank you so much. Appreciate you guys. So I want to start out with a little history, and we're going to talk about the Senior Navigator app. But Shane was on our advisory board along with the two physicians, and we quickly realized that Shane, not only being a nurse coming from clinical, he would help us design this concierge care senior navigator app. So we pulled him off of the advisory board and made him the EVP of corporate development. And this app has been about a year in the making. Dr. Ferris, I would love to hear a little bit from you on what your concept was as far as being able to close the gap with with clients and seniors and their families, and give them a tool to not be stymied to wait for that crisis. And maybe you could share a little bit about your vision, and then we'll
Well, sure.
talk about that.
And it's great. It's great to be back with everybody.
Yeah.
When we first started talking, this is now over a couple of years ago, between yourself, your co-founder Mark, and where CCA is very successful and very individualized and very concierge orientated. And then how to move forward. And we had those discussions in terms of how everything has evolved, how the world's evolved, how the healthcare landscape has changed since really CCA was founded. And my first thought was, we need more technology. We need to be able to get data, which you already were doing at scale, but do it better, faster, and do it digitally. And it's not that you weren't doing it digitally, but the interfaces and everything else that we now take for granted, everything from shopping online to, how we pay for things, needed to improve. So I'm thrilled. I mean, this is really exciting to be here today after all that effort and all the hard work. And it's humbling to know how hard it is to put this together, but I think we really have something that's exciting.
I agree, and I think giving the patients that you two serve a lifeline. It costs a lot of money to go to an elder attorney or a senior financial advisor, so people don't do it. They just wait for that crisis naturally. And I think that Shane, with his development on this app, has just really taken this to another level. And the success that we've had just in a short period has been phenomenal. I'll let Shane talk a little bit about that as well. But Dr. DeMorais, is there anything that you would like to share about what your vision was at the very beginning and kind of where we landed today?
I I'm going to agree with Dr. Ferris. I think we were just trying to give people a tool that was number one, realistic, and number two, truthful,
Mm-hmm.
because the information as you move, a block left, a block right, or to the next town changes.
Yep.
And that was the difficult problem we were facing. And when we first met, we talked about having these conversations with families, and it was very difficult. And, it would take me an hour. And now, with what you guys have done with Shane's capabilities and skills and knowledge, and with everybody's input, has made it to where a person can go in there and, get what's needed to really accomplish a mission. So I look forward to what Shane has to talk about here in a few moments.
Perfect. I think we'll describe a little bit about the app and basically the URL code, and I'll let Shane, you are the expert, you're the designer, and if you could just share the 3 to 4 key points on what people do to go down to navigate the app, so our audience knows exactly kind of what we're talking about the Senior Navigator app. That would be helpful.
No pressure.
No pressure. All right. Well, I'm getting a lot of credit here for the development, but the truth is that it came from a lot of experience that I didn't have. Concierge Care Advisors has now been in business for 15, 16 years and have placed over 20,000 families, and have done so in a way that has earned a customer experience score, or a customer score, of 4.9 of 5 stars over 600 different reviews. That's remarkable.
Mm.
That's really remarkable. So that's what really drew me to the company in the first place, was the level of touch that the advisors put into the process, the level of involvement that our physicians sitting here on the podcast with us today. I mean, we have a vascular surgeon, we have a concierge physician who specializes in patients of this demographic. It's a fantastic dynamic that just happened to work out. And I was a nurse that knew how to write software, and so here you go. But it really, I think the important piece is the team that put it together. I just wrote the code for it. What's different about this, and as we've been talking to some of our partners that we've formed some relationships with over the past few weeks since the app has been live, is that we welcome you to go out and try our competitors. I'm not going to name any names, but go out and try do some Google searches and go out and look for senior living options on the wide internet. Experience what that's like, and then come over and try Concierge Care Advisors. I'll ruin the surprise and tell you what's going to happen is that they're going to ask you for pieces of information, and then they're going to ask you for your contact information, and then your phone's going to start ringing, and your phone's is going to not stop ringing because they have sold your information to many different communities, many different lead aggregators, and you are going to be hunted down until someone finally gets you to a place where they get to collect a commission from you. We've decided to take a little bit of a different approach, and that's what the Senior Navigator app is all about. Is the easy way to say it is it's quality, not quantity. When you come to the Concierge Care Senior Navigator, it's a bit of a lengthy process. There's roughly 12 questions that ask you about health. Then from those 12 questions, we will give you a clinically based recommendation on if in-home care is right for you, if assisted living is right for you, or perhaps if memory care. But we look at the spectrum of options, and we give you, without you telling us who you are, without you giving us a phone number or an email, we give you a recommendation based on your personalized information, things about clinical isolation, falls, medication history, all of those things. That it takes 12 questions for us to give you a recommendation of a senior living option. Then based on that, we've built some pretty complex algorithms that are able to predict cost for both in-home care, assisted living, and memory care situations. Very detailed pricing that is based on, again, those 20,000 placements and pricing data, everything that we've done over the past 15 years. But again, we don't know who you are as you're using the tools until you tell us who you are. So you get a recommendation for assisted living, memory care, in-home care. You get pricing based on your zip code. You put in your budget information. You get a cost planner that tells you how long you can afford your care plan. And at the end of all that, you can talk to one of our advisors. But it's up to you for you to tell us to call you. So it's a completely different model, one that I think the market needs very much, and very proud of what we built.
So are we, Shane. And I think that is the thing that is so easy for me to talk about in the industry, because as we know, seniors are so vulnerable that they're afraid to give their information, which we are glad that they're afraid to give their information, right? Our podcast coming up after this is about senior exploitation. So they are afraid to give that information. I love that it was designed with the factor that they don't have to log in, don't have to, give their information, and it's totally secure. And it isn't until the very end where they want to speak to an advisor and have that scheduled appointment where they will have a phone call from somebody at the pre-designated time that they are requesting, which I think is wonderful. Can we talk a little bit about how I think you've shared a couple times about how we got the pricing from all of the original 15 years of history that we've done in the past, which I've put plenty in, and I think we come in within $300 of care. And I think at a community level, and I was talking to other people, doctors, that sometimes we'll go tour with a family member. It might be today on a Thursday, and it may not be until next Tuesday that a nurse can go out and do an assessment and give pricing. So I was in a situation with one of my advisors, Alicia, and the family, you could tell, were very anxious about hearing a price. They didn't know if it was $500 for care or 2000. So I was able to pull out the app and give them a rough guesstimate. And you could just see they were diffused. They were just like, oh, a deep breath, and we're perfect. I think we can
Right.
handle that.
Well, and that's what most people are used to. And in
Right.
every other part of life, there's in an economy like ours, you for the most part know what the sticker price is,
Right.
right? Whether it's at the store, at the car dealership, what you negotiate for a house, or so on and so forth. But healthcare is different, and it's complicated. And we're not here to rip that down. It's complicated for a lot of
Right.
reasons,
Yes.
but it's very clear that these choices impact health impact these choices.
Hmm.
And medical debt is a major problem. And I think this is the envy of others, to be able to start wrapping our heads around price. We were just chatting about this at lunch.
Mhm.
What's covered, what's not covered.
Right.
And so to take a step into the QuickBooks equivalent for this chapter of life planning is a breakthrough.
And I think the peace of mind that it can share with adult children, when, of course, somebody's at the hospital and you're like, do your parents have long-term care? Do they have a life insurance? Do they have, any assets that you know of? And of course, they're like, I don't know. They're totally private. And Shane, if you could talk a little bit about how at the very end, if they want to email that to somebody to have on file, what that may look like as well.
Sure. I'm glad I'm glad you brought this up, because it reminded me, for the people that are listening to this and then go use the tool. I want you to know that this is not a marketing tool. This is not a gimmick tool. It says right on the homepage, good data in, good recommendations out. We're not asking you to do it fast. We're asking you to take your time and put in the best data that you can. Guess at what you have to guess at, but the better your inputs, the better our outputs. And like Mary was saying, we get very close on price, and it comes down to us understanding those parts of your personalized situation that really drive cost, in whether it's at a facility or at home. There are certain factors like incontinence or falls or transfers. Those are things that really drive cost, and that's why we ask very specific questions. But I wanted to emphasize that this is not a marketing tool. This is a decision support tool that you can do in 20 minutes, or you can do in a week. You come back and you use it as you need it as a tool. I'll highlight one other thing, that as you get into the interactive financial planner that's at the end, for people that are homeowners, there's a lot of different options for you to figure out how to use your equity. Do you want to sell your home? Do you want to keep your home? How do you want to leverage your assets to pay for that care funding plan? But then at the end, we aggregate all that for you, put it into a packaged up report that you can email to yourself, review it with your siblings, review it with your physician. But that's really what we're aiming to do, is to provide you the information to make the best decision, and giving you the best guidance we can along the way.
Shane, I loved how you set it up where you could put in all of your asset information. Like, for instance, let's talk about the house. I'm going to sell the house because I think I need to. And I put in all my other information, my 401k, my stocks, my bonds, my savings. And then I'm 90 years old and it amortizes it where I can live 20 more years. Well, I'm probably not going to live to be that old, to be 110. So I like where you can go back and say, you know what, I want to gift the house to my kids. I want to preserve that. They were raised in that house and I want to preserve that. I love you can go uncheck selling the house and I'm going to keep it now, and then it changes the time frame based on that equity of that home.
Yeah, that's right. We tried to emulate the way that people actually think about it when they're going through this process, and to go through, kind of be in that mind space. So when we first started this about 8 months ago, we had actually called it a calculator, I believe. But what we call it now is an interactive financial planner, because that's very much what it is. These conversations don't really go, well, let's stack up the assets and then divide that by the month. It goes based on, well, mom said I could have the house, so I'm going to keep the house, but oh wait, we might need to sell that. And then there's the retirement accounts, and then there's a lot of family conversations that go into that. So we provided the dynamics for you to be able to look at the different parts of your assets and have those realistic conversations of how you're going to allocate retirement, home equity, savings accounts, property and valuables. All of that is in there so you can have those realistic conversations.
Can you also talk about, even though Concierge Care Advisors specializes in all things seniors, we are experts at senior housing. Can you also talk about how we give people information to make good decisions if they're safe at home and they may only need a few hours of care a couple days a week to be independent and remain independent? I love that we're not trying to pigeonhole everyone into getting out of their home and moving into housing.
Sure. And this is a little bit of a complex subtlety that is in our cost estimator portion of the app. When you get into if you're trying to make a decision between in-home care and assisted living and memory care, part of being able to stay at home is that you can afford the care for in-home. And when you're staying at home, you also have to think about what your actual ongoing home carry costs are. So you've got to think about your mortgage if you have one. You've got to think about the cost for food, utilities that you're going to have to continue to carry. So we don't forget about those things when we calculate cost. The other piece is when you start to think about the care that's needed and how different care agencies and models work. We planned all that for you as well. So we will give you a recommendation. For example, if you have heavy dependent needs and maybe you need someone there 7 days a week, we will give you a 7-day-a-week recommendation, but then also give you the tools to move that down to 6 days or 5 days, because maybe you can step in for a few days, or maybe one of the siblings or family or friends can step in. So we looked at those realistic situations where we're going to give you the baseline recommendation, and then you can make some decisions based on where family and friends step in and adjust that and see how things really work. But it is a subtlety that sits in the cost estimated piece that I think is quite valuable for people trying to figure out how they put it all together.
And I love you give the comparison between in-home care versus the assisted living. I think a lot of times people will think, oh, it's less expensive to stay in my home. But then they quickly realize that when you compare 24/7 care to 24/7 care at an assisted living, that it's probably at least 50% less, shooting from the hip. But
And the overhead and the scheduling and all the things that go along with that. So, oftentimes, and I've seen in some of the users we've tested with, that oftentimes there are things that you just don't think about until you ask the right questions. And a lot of times that social isolation and depression, those are all things that can be treated with medications, but they can also be treated with being in the right place. And so sometimes, as much as you want to stay home, maybe assisted living is the right fit for you, and we help you make all those decisions.
perfect. Dr. DeMorais, you being a specialist in concierge care medicine, how do you see this fitting in with your seniors that may not be able to stay at home, or maybe wavering safety versus somebody coming into the home or making a transition? Do you think it would be helpful for them to be able to utilize this tool?
Yeah, this is great because they can explore sectors of care that either we don't converse about or they don't think about. It gives their families a tool now that they can explore and have conversations either with their financial planners or their trust, and really put it all together in a package that makes a smart decision. Because I've seen families make a decision and move in a direction and then find out it's not right.
Right.
And typically we start with home care because it's the easiest, right? And you can transition from there to assisted living or independent living. because it's hard once you move into an independent living facility, especially if you're moving your home.
Right.
It's much harder to get out of that. And a lot of times people don't understand their finances as well as I think they should,
Absolutely.
or what occurs with it, or the. I have a lot of people who don't even have their assets in trusts, which is kind of interesting, or they don't have a will, or so.
See that all the time, don't we?
Yeah, we do. We really do.
And I think, as Shane mentioned about in-home care, people will say, well, it's $42 an hour average, roughly, but they don't look at the cost of still running the home, right? So I think Shane, in pointing that out in the calculator app, when you're going down with your finances, is so important. How much is it for your mortgage? How much is it for food, for electricity? And so you really see how much it is to stay at home. You're not just looking at the care cost. How much is it to run the home? So I think that's really important.
Yes.
Shane, we've been having some fun talking to fire departments out there. There's about a dozen of them in the state of Washington that have agreed to partner with the Navigator app. And I would love for you to talk about that and what it looks like out on the field, and the prescription pad and what they would be handing out to their patients that are vulnerable. We know everyone that calls 911 doctors. We know not everybody is a 911 situation, right?
Right.
It might be welfare. It might be my mom hasn't taken her medication and she's a little loopy, those kind of things. So I would love for Shane to talk a little bit about the fire department's success that we've had in the last couple of weeks.
Sure. And this one was a little bit of a surprise to me. Early in my career as an Air Force medic, I used to ride on the ambulances, and I don't recall ever being on an ambulance where things were just going well on the other end when you got there. But when talking to the fire departments, we've had some really great conversations. That it's not necessarily those crisis calls, but it's the follow-up calls and the community service. And I hadn't really thought of that angle, but but Mary and some of the folks for the fire department did, because they have these these engagements with people in the community that have repeated calls or issues or falls or just interactions with the community. So what a great opportunity for the fire department to be able to feel less helpless about the people that they're serving. I really appreciate the faith that they have in us to help take care of those folks. But yeah, we were very excited about I know it's roughly 15 fire departments we were able to partner with just this week, and really looking forward to future partnerships with other police departments, emergency workers. But these first responders see people in everyday situations every day. And they've got crises they need to manage, and they've got calls they need to go on. So it was really a very smart partnership for us to work with those emergency services. That we can pick it up from the good work that they do in the community. Very great partnership. And the way that it's working is that they will leave you with a prescription pad that has the contact information for one of our advisors for the Senior Navigator app. But very smart way to interact with the community and to help our first responders feel a little bit better about when they pull away from somebody's house, knowing that we'll take care of them.
Perfect. And we know seniors, when they see a prescription written from a doctor, that doesn't get recycled. And so we were told by the fire departments that was a great concept to be able to write it as a prescription. Call these guys, talk about housing, talk about the Navigator app, and set yourself up for success to be able to enjoy your retirement, whatever that may look like. Most of these fire department calls, and I shouldn't say most, a lot of them are going to house calls. Not just assisted living, adult family homes. So we do know that people feel perhaps overwhelmed. They may have been in the home for 65 years. They don't have a lot of liquid assets, a lot of savings, but they have their home. And they are so stymied about, how am I going to downsize? What am I going to do with all my stuff? That they don't do anything. So we're really hoping that this tool left behind on a prescription pad that they'll just take a picture of the URL code that will really close the gap to give people the resources they need to at least look at what their options are based on reality. And even if they're Medicaid, state pay, we give them an off ramp to be able to get the resources they need, and are certainly here to be an advocate for those people as well. We give 20% of our resources back to low income and Medicaid, and that is through our our senior advisors, and they all just do a great job with that as well. So there's somewhere for everyone. I will promise you that. Shane and doctors, is there anything else that you would like to say about the Concierge Care Senior Navigator app that we perhaps didn't touch upon today?
No, I love it. I think that where we're going is, we're all trying to understand the pre-medical inputs that lead to health problems, whether it's chronic disease, acute problems, or as we age, that point we all fear of just our health falls over the edge of a cliff. And if we can start to walk that back, these are actionable results of getting that information and doing something about it, and not just writing it down on the chart to say, we've checked that box, but actually do something about it. And that's very exciting.
I appreciate that. And there's a couple points that I that came to mind when you mentioned that. So a couple I will share with you. One of them being, it does talk about diagnosis. And so if somebody checks the box that they have diabetes, that we know they're either on an oral med or an injection. So at that point, we know also the communities that do injections and some that don't, right? And also with memory care. Shane, when he set it up, he, I think, learned something new as well, that if you didn't have a memory diagnosis, you can't go into a memory care. So when you're filling out the information, even though you might be pleasantly confused and you're needing some of that support, that memory care comes up, that basically you cannot move to memory care without a diagnosis from a doctor. So that's helpful as well. So not everybody that has memory loss will be pigeonholed into the memory care. As we know, residential adult family homes handle memory care as well, secure memory care for people that are eloping. But I think a lot of times just leaving that, where I'm working with a patient right now and he's on the cusp. He probably needs memory care, but to keep him alert and oriented as much as possible, it's nice to have him engaging with the assisted living crowd as well.
That's really interesting, because Shane just talked about how social isolation, there was a segue implied, at least the way I heard it, that leads to a health problem. And you just said the opposite, which is engagement may be walking back problems. And that's a great opportunity. And so my pie in the sky dream is that we're opening the door with the way I like to feel we're trained as physicians is, if we're going to do something, we're going to do a test. How's it going to change what we do? And if we're getting this information and we can do something about it, and that makes a difference, we can walk problems back, which gets a lot of things into alignment. It's patient-centered. It's what they want. They get a chance to plan and talk. It's easier for everybody else, all the way up to the big social level. So I think it's fantastic.
Patient center, I love that, and hoping that adult children start having this conversation with their loved ones. What are your wants, mom and dad? Let's have this conversation prior to a crisis, prior to the hospitalization, when our staff comes in bedside to say, hey, remember that place we wanted to show you? Now I can show you a picture on my phone. But it's always best that we can look at things prior to crisis. What I tell people is, our job is to keep you safe at home while we're preparing for the next destination. That may or may not happen. So Shane, doctors, thank you so much for your visions on this, for bringing it to fruition, Shane. The last year has been a roller coaster, but
Yes.
but I am reaping the benefits of being out talking about it and promoting it and talking to fire departments, case managers, financial planners, and I have the joy to share your good work. So thank you for setting me up for success, Shane. I appreciate you and all you do.
You bet. And I'm gonna leave one more thing that you just made me think of as you were talking about the questions we ask is the 12 questions we ask, we don't ask in isolation. So we do ask if you have chronic conditions, and diabetes is one of those chronic conditions. But just as when you go to your physician and they ask you one question, they don't send you out with a prescription. They ask you more questions to understand the complexity of what's happening. And that's what's happening when you ask you those questions. We're building up a complex case in the background. So we know if you live far from a pharmacy, and if you take a lot of medications, and if you have maybe depression, we're looking at someone who has potentially a mood disorder and polypharmacy issues that can't get to the pharmacy. So it's a compounding situation. But all of that in a very clinical way is built into the way that we've built our recommendations. So again, very proud of that. So thanks, Barry, for the opportunity to talk about it.
Perfect. Thank you, Shane. Thank you, doctors. Appreciate you guys.
Thank you.
And thank you for listening to podcast number 25 for the Senior Spotlight. You can find us at www.conciergecareadvisors.com, and you can phone us at 855